continue the idea of health and wellness. And it was mentioned continuing the Everybody Walk campaign, getting people moving, adding fun to being healthy. It doesn't have to be boring or sad or hard or dreadful. It can be fun. We all like to dance. There's nobody in New Orleans that doesn't like to dance. So we can dance, we can move, we can have fun. We had a program called Tobacco-Free Campuses, and I want to continue that. And I'll go into the tobacco thing. I would talk an hour about tobacco because I'm passionate about it, but young people is where we need to affect. 90% of all smokers start before the age of 18, 99% before the age of 26. If we can just get that young person not to take that first cigarette before they're 26 years old, they have less than a 1% chance of ever starting. And the tobacco companies know that because they market over $1 million an hour, $27 million a day to that 18 to 26-year-old. They know where to market. And so we know also where we can concentrate our energies. One of the things we hope to do is coordinate some national and international conferences to bring to the city of New Orleans. And along those lines, one of the things we're looking at is the 50th anniversary of the Surgeon General's warning on the cigarette package is going to occur in January. So we're going to celebrate it the entire year. So during that year, it would be good if we could coordinate a conference to come here. Many of the countries use our Surgeon General's report for their support. I was in Australia about a couple of weeks ago, and they told me they use my Surgeon General's report on youth and young adults in their legal defense, where the tobacco companies are suing them for restriction of trade because they've taken their names and put these pictures on the cigarette package. So those are some of the things we're looking at. Also, other conferences around health and wellness. I will continue to volunteer at the clinic in BioBattery. I can't leave my patients because I love seeing them, and I need the clinical experience to keep up my clinical skills. It's only about an hour, I guess, and 45 minutes, less than 2 hours away from here. So Dr. Francis has agreed to let me continue to go over and see patients. And speaking of that, many of you may know that we went through several hurricanes. We went through Hurricane Georges, we went through Hurricane Katrina. And after Hurricane Katrina, the day before I was supposed to reopen the clinic that we had rebuilt, we were going to open it on the day after New Year's. New Year's Eve, it burned to the ground, and it was very devastating. So my heart goes out to the people in New Jersey who experienced that same thing yesterday. The hurricane is tough enough, but when you've rebuilt, you put all your energy and sweat into rebuilding, and it's burned, everything's gone. It's a feeling that's hard to explain. The whole town tends to feel it as well. I had a patient who, while we were looking at the smoke and embers and the fire trucks there, an elderly lady sent me an envelope by her granddaughter, and in that envelope it had $7. It said to help rebuild the clinic. She didn't have that $7. So I know it affected the entire town, and I can only imagine what the people in the boardwalk in New Jersey are feeling today. So I'll keep telling stories, so I'll slow down a little bit, but as a Catholic institution, our ultimate mission at Xavier is to create the just and humane society by preparing our students for leadership and for service. And the university's education and culture prepares us for that. The graduates for continuing their spiritual and moral and intellectual development. The Sisters of the Blessed Sacrament instill that charism in this institution, and it continues. It continues through all of us. Sometimes we don't even realize it, but we will look at something and say, we want to help. We want to be a part of it. And that's the thing that we want to keep going. And that's what I believe this Mother Catherine Drexel wants us to do through each other. through our acts of kindness, through our acts of service, through our acts of leadership. And so that's why it's so important for me to be here and so exciting for me to be a part of developing our young and future professionals in public health. So thank you so much, and thank you for so many people and so many friends and family to be here today to come out for this occasion. Thank you very much. Thank you. My role will be the endowed chair in public health. We're developing a department of public health. We currently have about 32 students that are majoring in public health. And the role is to basically help the faculty create the curriculum, do some teaching in classes. I'm going to be trying to pull together some international conferences to bring to New Orleans to focus on public health, particularly with tobacco and exercise and health and wellness in general. So those are the major things we're doing: engaging the community, having the students go out into the community and do service learning.
There's no question in our minds at Xavier that being number one producing African American graduates from medical school is an anomaly. We are too small a school to be number one, which says in effect somebody else isn't doing enough and we need to do enough, but we're not going to stop. We'll continue to be, if you want to call it, a model of how this is done. And there is going to be a great need after the health care is finally passed and accepted to have primary care doctors in this country. And most of them are going to have to be African Americans because they will be serving that population where they have not been served in the past. And that this is an important jumping off stop because this lady represents what all of us said we wanted our children to be one, respectful of themselves, respect other people, and to serve. But before you can do that, you got to be educated. And she became educated, and this is an interesting story. She didn't go where the money was. She went where the need was, and that is going to be the future. And the greatest civil rights movement of the future is going to be education, without question in my mind. And that is to produce those people that are needed to teach young people, to serve young people, and to take care of this country.
Xavier has a tradition of training wonderful health professionals. The number one in the nation of getting African Americans to go to medical school and graduate from medical school. Number one in the nation of having other science specialties, physics, biology, PhDs. We already have a good foundation to start on. So adding public health to that foundation is just a natural, and building on that to have all of this holistic type learning for the student will be a great experience for them.
I think it just shows that our public health department is going to do great things and that we need to be recognized on a national level. The students here are really dedicated and we're really ready to kind of get out into the world and become the next generation of leaders that we're being trained to be. So we're really excited that she's here.
Her role is number one. She has been on the national scene. She is connected internationally. She came here from Australia working on a conference that she's going to bring here. She's going to give visibility to New Orleans in more ways than any of us realize, and will do so because she's an African American female and she's at an African American university that many people never think about. As Ellison said, we are invisible. We were the best kept secret in the United States until about 10 years ago when they looked at the record and found out where are these black doctors coming from that little school in New Orleans. Well, when she comes here, she's here now, when she brings to this city the international people who know her to talk about all of the things that she's concerned about, and having Xavier as that backdrop, I think we'll have a visibility that we never thought we'd ever get.
Our community here on the Gulf Coast in New Orleans and the entire Gulf Coast is a perfect laboratory for public health. We've shown resilience. We've shown what it's like to respond to disasters, to issues of poverty, to issues. We know how to bounce back. And this laboratory will help students learn, their research, their faculty, and we can translate that to the nation and translate it to the world to how to become a more resilient community and be prepared for the next disaster that may appear, either man-made or natural, that we'll be ready. And so the community itself can play a major role in that, to be prepared.
I'm just really glad that she's here. I couldn't ask for a better chair. I know she's going to do great things when she's here. All of us students are really excited to kind of get behind her and start working on all of her projects that she wants us to work on. So we're really excited.
It's a great time to be back in New Orleans, to have the opportunity to continue to impact the nation while impacting our local community at the same time.